Hi, how are you doing today?
Good, how are you?
Good, my name's Casey. I'm a student nurse from Valencia College. I'm going to be working with you today. Before we get started, I just want to verify some information. Is that okay?
Mm-hmm.
Do you mind stating your full name and your date of birth for me, please?
Yeah, Jean Doe, January 23rd of 85.
Okay, and your medical record number matches what I have here. Do you have any known allergies to food, medication, drugs? No? Okay, and on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you rate your pain level right now?
A 2.
A 2? Where is it located at?
In my head.
Does it radiate anywhere else?
Mm-mm.
What does it feel like? Is it throbby, achy?
Yeah, it's throbby like a headache.
Throbby? When did it start?
This morning, I think.
This morning? Would you like for me to call the physician to get any medication? No? Okay. Before we get started, I just want to let you know that I have an order to do a physical assessment. It's just to get a baseline status of your health as it is right now. Is that okay?
Mm-hmm.
Okay, do you know where you are?
Valencia Memorial Hospital.
Do you know what year it is?
2018.
And do you know the President of the United States?
Donald Trump.
Perfect. Okay, I'm just going to start by looking at your scalp. Do you have any difficulty hearing?
Mm-mm.
And do you have any difficulty smelling?
Mm-mm.
No? Do you mind sticking your tongue out? Smiling? Perfect. I'm just going to check your pupil size. Okay, and then I'm going to shine a light in your eyes, so if you could just focus on my nose while I do that.
Mm-hmm.
Okay, and then just go ahead and focus on that spot on the back wall right there, and as I move this into your sight, just look at that.
Mm-hmm.
Okay. Now I'm going to move on to your pulses. I'm going to check your carotid pulse one at a time. +2. +2. I'm going to move down to your brachial. And then down to your radial. And both of those are +2. And as I'm moving down, your skin is dry and intact. Your bony prominences are good. I'm going to check your capillary refill. And that's good. And your skin turgor. That's good. At this time, I would check the femoral pulse, but we're not going to be doing that for the sake of the video. Moving down, I'm going to check your +1. +1. Down to your posterior tibial, and then your dorsalis pedis. Okay. And as we're down here, I'm going to go ahead and check your strength. So if you could just press up for me. And then press down, 5 out of 5, and then pull back, and then go forward, 5 out of 5. Now I'm going to go ahead and check your strength of your upper body. Push against me, now pull, and now squeeze my fingers. Good, everything's 5 out of 5. Now I'm going to go ahead and listen to your heart. I'm going to be above your shirt. Start with your aortic, your pulmonic, your secondary pulmonic, your tricuspid, and then do you mind lifting for me? I'm going to do your mitral, and at this time I will listen to the apical pulse for 1 minute. Now I'm going to go ahead and listen to your lung sounds, so if you could just breathe regularly for me. And then just go ahead and put your hands on your hips like Superwoman. Okay, and you just face that wall. I'm going to go ahead and do your back. Okay, perfect. If you could just go ahead and lay down for me, I'm going to listen to your bowel sounds. When was the last time you had a bowel movement?
This morning.
This morning. And when was the last time you went pee or urinated?
2 hours ago.
2 hours ago. And then your last menstrual cycle?
2 weeks ago.
2 weeks ago. Is there any chance that you could be pregnant?
Mm-mm.
Upon inspection, I don't see any abdominal distension or discoloration. I'm going to go ahead and auscultate starting in your lower right quadrant.
Okay.
And if I didn't hear any bowel sounds, I could listen up to 5 minutes. Now I'm going to go ahead and palpate. Just let me know if you feel any tenderness. Everything good? Okay, perfect. That completes our physical assessment. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what would you rate your pain right now?
A 0.
A 0? Do you have any questions for me?
Nope.
Okay, you have a call light right here and on the other side of your bed. I'll be back in about an hour, but if you need me before then, just hit that button and I'll come back.
Okay.
All right, and at this time, I would document and wash my hands.
The video is going to be demonstrating the evaluation of your deep tendon reflexes. You want to make sure that you're checking reflexes that the patient is relaxed, but that the tendon is on some kind of stretch, otherwise you won't get a reflex from it. So we want to make sure that we test them in both upper and lower extremities, and we test them bilaterally. So we're going to start with the upper extremity and the biceps reflex. So this is a reflex on the biceps tendon. And what we want to do for this one is, again, the patient's arm is to be sort of relaxed in the patient's lap. And I'm going to put pressure on the biceps tendon in order to stretch it a little bit. And then I'm going to strike the tendon with the reflex hammer on my own finger. I should be able to feel the reflex in my hand, even if I can't see it in the muscle contracting. Alrighty. Again, for that one, you could see the arm jumping, but I could also feel the reflex myself. When you're doing the reflex, make sure that it's a quick, rapid, it's not a flunk down and hold it, it's a quick, rapid tap. So we'll do that again. And again, we want to make sure that we do that bilaterally. All right. So we also want to be able to do the triceps reflex. For the triceps reflex, again, we need the arm to be relaxed, but the tendon to also be under some stretch. So we need the arm to be bent. So generally we will hold the patient's arm out to the side and have their arm bent. And let me hold as much of the weight as I can. Okay. And again, strike the triceps tendon with the reflex hammer directly. And again, you notice a slight swinging of the arm out laterally when that's struck. And again, make sure you do the same thing on both sides. And so just relax the weight into my hand. And you notice the slight jerk of the arm outward. So finally, we're going to do the patellar reflex and the Achilles reflex in the lower extremity. So for this one here, make sure you find the patellar tendon and just relax your leg as best as you can. And the same thing on the other side. So this patient has good brisk reflexes. They're not hyperreflexic, but they're easy to see. Some individuals' reflexes are much more subtle than that and a little harder to see. Finally, we want to do the Achilles reflex. If I let the leg dangle like this, the Achilles tendon is relaxed and not under any stretch. So you want to push up on the foot so that the tendon is stretched. And it's generally easier to strike it with the back of a hammer, but you can strike it with the front. So again, just relax as best as you can. And then the same thing on the other side. Try that one more time. All right. So the next reflex we want to do is the plantar response reflex, which is also referred to as the Babinski. So what you're going to have the patient do is, if you could move back on the table a little bit for me, and I'm going to pull out the footrest. And so you want to do this is you're going to run an object relatively firmly across the dorsal aspect, the plantar aspect of the foot. And you want to make sure you use something clean and new each time, so that you're not, again, transferring things back and forth between patients, because this is a relatively firm pressure. So we generally use a new tongue blade for that. What you're going to do is, on the sole of the foot, you're going to run the tongue blade up the side and towards the midline. You want to do it relatively quickly and with decent pressure. This isn't a tickling motion. You want it to be relatively firm. And you want to watch for the direction that the toes curl. All right. So I'm just going to run this tongue blade across the bottom of your foot. Now you notice it was a subtle motion, but his toes curled towards the plantar surface of the foot. So toes down going is the normal response. If, when I did that motion, his toes pointed upwards, that would be upward going toes, or an abnormal response to the Babinski.